Good afternoon, my name is Joseph Phillips, and today I'll be performing an assessment of the neck vessels in the chest. The first thing I'm going to do is I'm going to make sure I have my equipment, to include gloves and my stethoscope. Then I'll introduce myself to the patient. I'll wash my hands, don my gloves, and begin my assessment. So I'm going to knock on the door. Good afternoon, ma'am. My name is Joseph Phillips. I'll be your nurse today. How are you feeling?
Well.
Okay. I'm going to be performing an assessment of your neck and your chest today. Is that okay?
That's perfectly fine.
Okay, now that I have consent, I'm going to be sure to wash my hands adequately, and go ahead and put on my gloves. I'm going to gather my equipment. Okay, ma'am, for the first part of this test, I'm going to need you to lay back at approximately a 45-degree angle, so if you wouldn't mind just laying back here. Okay, before I begin the assessment, I just want to verify that your information is correct. Can you tell me your name and your date of birth?
I'm Michaela Phillips, January 21st, 2005.
Okay, her information is correct, so at this point I'm going to go ahead and begin my assessment of her. The first thing I'm going to do is I'm going to assess, then I'm going to auscultate, and I'm going to palpate the vessels of the neck. I'm going to start with one side and then switch to the other. I'll begin with the left side. If you'll relax your head for me, turn your head all the way to the right. Just breathe normal and relax. I'm going to assess for any pulsatile mass, any abnormalities, or any jugular vein distension. Okay, I don't see any of those. I'm going to assess the other side for the same. Okay, you can relax and breathe normal. Now I'm going to move on to the next part of the assessment, where I'm going to use my stethoscope to auscultate. I'll be using the bell of my stethoscope. I'll be listening for pulse rate, rhythm, and also listening for any kind of thrill or any abnormal sounds that might be there. I'm going to begin with the left side of the neck for this. Again, using the bell. And for rate, I'm going to use my watch to get an approximate time for 1 minute to assess her pulse rate. Okay, her pulse rate is 70, even, no adventitious sounds. I'm going to move on to the next side. Okay, you can relax. Okay, again, pulse rate is regular. It's equal on both sides. No adventitious sounds are noted. The pulse rate is equal as 70 on both sides. So now I'm going to move on to palpation. And for this procedure, I'm going to use just the pads of my finger. I'm going to palpate the sternocleidomastoid region of the neck, and I'm going to feel for amplitude. I'm going to feel for any kind of bruit. I'm also going to feel for any kind of a pulsatile mass or any abnormality. I'm going to do one side and then the other, noting that not to do both at the same time. That way, don't cause the patient to have a syncopal event. You just lay back and relax for a minute. Okay, turn towards me. Okay, you can relax. The amplitude is rated at 2, regular. There's no abnormal feelings. There's no pulsatile mass. There's no bruit, and there's no indication of any kind of structural abnormality that I can assess at this point from the assessment that I've done thus far. The next assessment that I'll be doing will be the assessment of the chest. All right, so for this, I'm going to follow the same sequence. I'm going to inspect, auscultate, and then palpate the patient's chest. I would provide privacy and expose the patient's chest, but for this setting, I'll be assessing through the clothing that she has on. So the first thing I want to do is I want to focus on inspecting the left sternocleidomastoid. I'm going to inspect second clavicular space, left sternocleo, right second intercostal space sternocleo, and then I'll do the third, fourth, and fifth intercostal space, which is the Erb's point. The fifth is the maximum point of impulse, or the mitral valve. So it'll be aortic, pulmonic, Erb's, and then mitral valve. Okay, just lay back and relax. I'm assessing for any abnormal sensations, any pulsatile mass, any so I just assessed the aortic space. I'm going to move over to the right second intercostal space, which is the pulmonic. The third, fourth, and fifth. I would expect to feel more at the fifth, which is the point of maximum impulse, than at the others, because this is the place of the mitral valve. Impulse, maximum point of impulse. Okay, so I feel no abnormal findings at this time. So the next thing I'm going to do is I'm going to go ahead and auscultate, and I will auscultate in the same sequence that I have just palpated. Yes. I should have inspected. Alright, so we'll begin the assessment of the chest, starting with inspection. Then we'll move on to auscultation, and we'll finish with palpation. Okay? So we're going to inspect for any notable abnormalities. Under normal circumstances, we would expose the patient, but for these testing purposes, we will inspect through the garments. I'm noting the aortic space, which is located at the second intercostal space, right sternal border. Then I'll move on to the left sternal border, second intercostal space, which is the pulmonic. Then I'll move to the third, fourth, and fifth inspection areas, intercostal spaces of the right sternal border, which are the Erb's point. Again, looking for any kind of pulsations or abnormalities. And then I will finish up my inspection with noting the point of maximum impulse, or the mitral space, which is located at the fifth intercostal space. Okay, once that assessment is complete, I'm going to move on to my auscultation, and for that I'll need my stethoscope. I will do the same location of assessment that I did with my inspection. This time, instead of the bell, I'll be using the main diaphragm, and I'll be listening for rate, rhythm, noting any kind of bruit and any other abnormal sounds, murmurs, and also trying to assess the amplitude. All right, so second intercostal space on the right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third, fourth, and fifth spaces, left sternal border, Erb's point. Finishing with the fifth space, point of maximum impulse, or the mitral space. Okay. All areas have an amplitude of 2/2. Rhythm is equal, regular. S1, S2 is noted with no murmurs or other adventitious sounds. I will now palpate and assess for any tenderness or any other notable masses or abnormalities. Same spaces. Second space, second intercostal space, right sternal border. Second intercostal space, left sternal border, which is the pulmonic. Third, fourth, and fifth were Erb's points, left sternal border, with the fifth being the point of maximum impulse. And this is where my sounds are the loudest and the sensation should be the strongest. Okay, and to conclude the assessment, I'm going to have the patient sit up. Go ahead and sit up for me. And just bring your legs to the side. And then I'm just going to listen on the same spaces with the bill of my stethoscope, just to ensure that no sounds were missed. All right, so second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third, fourth, and fifth Erb's point, with the fifth being the point of maximum impulse of the mitral space. Okay. I had identified no abnormalities during this assessment, and this concludes the assessment of the heart and neck vessels. Thank you.